Well, there are now a handful of the new COVID variant Omicron cases in Canada. In the news this morning, Halton has added one. There may be more. Lots to talk about with infectious disease expert, infectious disease specialist, Dr. Zain Chagla. Happy Friday. Thanks for joining us. We haven't talked in a while since you and I last spoke. Yeah, Omicron.
Yeah, I know.
Like, what the heck? You know, like, we were in pretty good shape. Delta came along, and we kind of got on top of that. And then, again, what the heck? Omicron.
I mean, you know, this just shows how unstable this pandemic is.
Yeah.
And, you know, a lot of people are relating Omicron, and rightfully so, that, you know, the origins maybe in sub-Saharan Africa. They may not. But, you know, we know that this pandemic is going to rage on as long as we don't protect everyone. And so, you know, the global vaccine effort, unfortunately, may be a part of this in mind. And, you know, hopefully the lesson learned here as we deal with this is, you know, part of our response has to be making sure that people all around the world have access to vaccines, not just us.
Yet so far we seem to be boosting or repeating mistakes, because with the boosters, you know, the immediate knee-jerk response for Canada, including countries like Canada, is okay, we got to get booster shots, and now is 50 and over, instead of directing these vaccines to the developing world. And in countries like South Africa, to get, you know, that population vaccinated, because this is where the mutations flourish.
Yeah, absolutely. Look, you know, and if you're of an age group that's, you know, offered a booster, then there's no reason not to take it. You know, these are vaccines that are largely been procured that are hard to get out of Canada because of expiry dates. And so, you know, there is still a reason to get it. If you're offered one, take it, because again, you know, your efforts to save doses for other countries aren't going to happen with doses that are already on our shore. But, you know, that it goes back to the primary problem is, why are these doses on our shore? And, you know, I think, again, we really do have to look at how we procure doses and why we procure doses and how much we procure, as we're not a manufacturer of vaccines. And you know, having 14 million doses sitting in freezers isn't, you know, tolerable in this day and age when there's people that, you know, don't have access to a first dose.
Yeah, and that 50 to 60 age group is relatively low risk, right?
Yeah, I mean, for the data we have now, you know, 60 to 69 is probably slightly higher risk than higher. But, you know, for 50 to 59, we're talking about a risk of a breakthrough infection leading to hospital by about 1%. And, you know, in the context of this whole pandemic, that we've been vaccinating people, there's been 9 fully vaccinated individuals under the age of 60 that have landed in the ICU, and 6 of them that have died. And I can assure you that, you know, some of those ICU people are people with major immune compromising conditions where, you know, any number of vaccines would probably not work in that sense.
Yeah, let's still with our Omicron response, so boosters, but now let's talk about travel and travel restrictions.
Yeah, it's silly. I mean, at the end of the day, there's no meaning to this, right? South Africa discovered that there was a problem, but they weren't the cause of the problem. They were the people to discover it.
And
we're now
penalized for that.
Cases in the United Kingdom and the EU that predate when South Africans raised the alarm. So,
right. So they're penalized for being transparent and exposing this.
Yeah, and again, it's not necessarily, I mean, we remember back to 2020, you know, Canada was not seeded with COVID from China and Iran. It was seeded by COVID from Europe and the United States. We have good genomic data to say that. Yeah. So, you know, we may be repeating the same mistakes. The United States is showing a lot of community transmission now. And again, you know, that's the place where you don't necessarily have to have a test to come back over the land border.
It's in Hawaii now.
Short term. So again, like, you know, we might be seeing more introductions from the United States than we will from these countries that we think are the source of things.
Yeah, I was mentioning Hawaii. I mean, a remote island, and cases are cropping up there. And
clearly didn't get there, you know, by anything else, right? And again, you know, we talk New York has 5 cases in a convention apparently that someone got exposed to.
And a guy from Minnesota who went to New York. So yeah, exactly. So yeah, so there shouldn't be those travel bans, and hopefully, you know, again, getting the world vaccinated. That's the bottom line takeaway here.
Yeah, absolutely. Absolutely.
Yeah. Okay. Well, we've run out of time, but you know what? Let's talk again next week, and hopefully it's a better picture when we talk. We got to talk about the weekend picture. Good to see you, infectious disease specialist, Dr. Zain Chagla.